Okay, thank you, Lieke, for the introduction. And indeed, I will tell you some things about pertussis in preterm infants, and I will give you an update on the maternal pertussis strategy. And this will be the content of my talk, and I will start with the preterm infants. I have no conflicts of interest to declare. I'm entirely paid by the Ministry of Health, Welfare and Sports and nothing else. And this is the group of people in the epidemiology department who are also working on the surveillance of the National Immunization program. And some of them you've already heard earlier this morning. So, to start with another quiz, who of you knows where the abbreviation WPD stands for? Not all together, please. So, it stands for Wereldprematurendag, or to say World Preterm Day, and that's tomorrow. And they wanted to seek attention for the fact that worldwide 1 in 10 babies is born prematurely. So it's a very important topic. And in general, we can say that currently preterms are vaccinated the same as term infants without correction for gestational age. They receive the same immunization schedule. And what we see in real life is that the first dose is often delayed, and I will show you some aspects of this situation. Preterms are at increased risk for severe courses of infectious diseases, and due to the fact that they are born earlier than expected, the transplacental antibody transfer can be decreased. And furthermore, their immune response, at least at the primary doses, is less than the immune response in term infants. And this is shown also in this table. On the left side, you see a table of the risk of invasive pneumococcal disease. And on top, you see the infants with a low birth weight, and the risk is compared to infants with a normal birth weight. And as you can see here, the risk in low birth weight infants is increased, and for this figure it is even statistically significant. The same holds for infants who are born prematurely. And please pay attention to the fact that preterms are here defined as less than 38 weeks of gestation, while we in the Netherlands often say it's 37, 36 weeks of gestational age. And again, compared to infants who are born on time, the risk for invasive pneumococcal disease is increased. At the right side, you see data related to pertussis, and the black columns represent low birth weight infants, while the gray columns present the normal birth weight infants. And here on the x-axis you see the age at onset of disease. And as you can see here that low birth weight infants acquire pertussis somewhat later in life compared to normal birth weight infants. And as you then look at clinical pictures, then you see not that many difference, but you do say that the low birth weight infants are at increased risk for hospitalization compared to term infants. And that's what we try to study also in the Netherlands. So we listed all 0 to 2-year-old infants who were hospitalized for pertussis during 2014. That were somewhat less than 1,200 infants. And we developed together with experts a data extraction form, and we invited all hospitals in the Netherlands to participate in this medical record study. And after informed consent of the hospital, we made an appointment for the data extraction. And when all data were collected, we tried to link the medical data to the vaccination data by a trusted third party. And in the next slide, I will show you some data on the medical data, not on the vaccination, the linking with the vaccination status, because that analysis are still ongoing. Here you see the results. A bit more than half of the hospitals participated. Among them, there were 4 out of 8 academic hospitals depicted in red, and 19 out of 26 top clinical hospitals depicted in blue, and the remainder are the local hospitals depicted in yellow. And we were able to extract data from 680 medical records. If we then look at the sex distribution, it's more an equal number of boys and girls, which is to be expected. And if we then look at gestational age, unfortunately, we were not able to find information of on gestational age in all the records, but we could find it in 413, together with an additional 58 in which we found written information of a term pregnancy. So that means a pregnancy of at least 37 weeks of gestational age. And then if we look at the information of these 413 together with these 58, we found 80 preterm infants and 391 term infants, meaning a percentage of preterm infants of 17%. If we assume that all the infants with an unknown gestational age were also born term, so on time, the percentage of preterms will decrease, but is still 11.8%. And that's higher than on average in the Netherlands, because about 7.4% of the infants born in the Netherlands are preterm. So we can conclude from this information that pertussis of preterm infants are at increased risk for hospitalization due to pertussis. And here you see the distribution of the gestational age on the x-axis and the number of infants in our study. 13 were born before 32 weeks of gestational age, and 67 are born between 32 and 36 weeks, and the remaining is born on time. Of course, the birth weight of term infants is higher compared to preterm infants. That's no surprise. But if we look at the age the infants are hospitalized, preterms on average are hospitalized when they are 1 month older compared to term infants. And this is also seen here in this graph. The blue line depicts the preterm infants, and you see that between 1 and 3 months of age there is some increase with a peak at 3 months, while term infants in general are hospitalized when they are younger. Also, the duration of hospitalization in preterm infants is longer compared to term infants. Not that much, but it is on average 1 day more. The graph shows that in general, the vast majority of infants are hospitalized for less than 7 days. If we then look at the timeliness of the vaccination, Petra Woestenberg did an internship at RIVM. Now she's a colleague of us working at the SOA department. And she looked at the gestational age and the birth weight in relation to the timeliness of the first dose. And what she found is for both gestational age and for the birth weight, that the lower the birth weight or gestational age, the lower the percentage of infants that's vaccinated on time. Meaning that preterm infants or low birth weight infants often receive the first dose later compared to term infants. And Colleagues of mine, Guy Berbers and Elspeth, she's also in the room, are currently conducting the PRIMA study to look at the immunogenicity of the current schedule in preterm infants. And that's because they want to gain more insight in the best schedule for preterms. And the PRIMA study is a prospective observational multicenter study with 3 groups of preterm infants included. And they received the normal vaccination schedule, and they are sampled before and after the primary series and 1 month after the booster dose. Inclusion is ongoing. I think it's not finished yet. No? Okay. And first results are expected late 2018. So we must wait a little, but then there will be very nice data on immunogenicity in preterm infants, I hope. So let's move on to maternal pertussis immunization. And it is already mentioned this day a couple of times. The primary goal of the maternal pertussis immunization in general is to increase antigen-specific antibodies, and those antibodies can protect the mother herself or the unborn baby, but in the case of pertussis, they are used, or they are transferred to the baby through the placenta, and they aim to protect the infant in the first months of life. A possible disadvantage is the blunting, meaning that the maternal antibodies can decrease the immune response of the infant after the infant vaccinations. And of course, safety is a very important issue, and that means in general that live attenuated vaccines are contraindicated during pregnancy. While we are talking on pertussis, which is an inactivated vaccine, there is no contraindications, and in the meantime there are many studies performed on safety, and to date no safety signals are found, so we can say that the maternal pertussis immunization is a safe intervention. And last year, Liz Miller was here to talk about maternal pertussis immunization and all the data that are available from England and the UK. So I will not repeat all those information, but I will give you some update with many thanks to Helen and her colleagues from Public Health England who wanted to share those data with us. And here you see data on the vaccine effectiveness. So the effectiveness of the prevention of pertussis in newborns due to the maternal vaccination. And the top 2 rows are data that are already known. Public Health England assessed data on vaccine effectiveness of this maternal pertussis program in 2 ways, using the screening method and by a case control study. And they calculated the same vaccine effectiveness, 90% or 93%. And they were able to update the data because the period is in place for a longer time, and they reassessed the vaccine effectiveness of 91%, but the confidence interval is more tightened because of the larger numbers that could be included. And the vaccine effectiveness of 90% is very good. So that means that if you are vaccinated during pregnancy, the risk that your baby will contract pertussis in the first months of life is 90% less than if you are not vaccinated during pregnancy. They were also able to calculate vaccine effectiveness against death, and that amounted to 95%, which is also very good. That's also confirmed in this graph, where you see the number of infant deaths related to pertussis and the enormous peak in 2012, which was the reason they decided to implement the program. And now you see for the subsequent years a decrease in infant deaths and almost all infants who died due to pertussis are born out of mothers who were not vaccinated. Only those two purple cases were born out of a vaccinated mother. And I don't know the specific background of those vaccinations.
They were immunized very close to
Delivery.
So they wouldn't be expected to be optimally protected.
Did everyone hear the answer? No. The mothers were vaccinated very shortly before they gave birth, so the time to pass the antibodies from the mother to the child was very short. So it was a suboptimal vaccination. This is a very difficult table, but I will try to explain it to you because it reflects the data on the blunting. And what you see here on the first row is infants who contracted pertussis, meaning 30 infants, who exactly received one infant dose, in which contained pertussis. And of those 30 infants, 6 mothers of them were vaccinated with a maternal pertussis immunization. And if this is compared to the average coverage of the maternal pertussis immunization, which is 62%, this means that the maternal pertussis immunization had an added benefit to the infant vaccine effectiveness of 86%. And for infants with at least 2 doses, we can say the same. There are 9 cases who contracted pertussis, 5 of them who were born out of a vaccinated mother, meaning 57%, compared to an average coverage of 63%, leading to an additional benefit of 28%. If you would expect that blunting would have a negative impact on the vaccine effectiveness of the infants, then you would expect that this percentage, just the percentage of infant cases of vaccinated mothers, would be higher than the average coverage in the general population, which is not the case, and this means that the blunting does not have a negative effect on the infant pertussis schedule. Is it correct? Yes. If you want more, Helen can explain everything to you. So I promised to keep these data confidential, but luckily we don't need to anymore because just at the end of last week it was published. So now it's in the public domain and we can all read it. And there was an additional study in the United States that looked at the effectiveness of maternal pertussis immunization, and they concluded that infected infants whose mothers received Tdap during pregnancy had a lower risk of hospitalization and ICU admission, and could stay less longer in the hospital compared to infants of unvaccinated mother. So this is a further proof of the benefit of the maternal pertussis immunization. Now, looking at the timing, when should you immunize the pregnant woman? At the 3rd trimester or at the 2nd trimester? The group of Claire Ann Siegrist studied this, and they concluded that vaccination during pregnancy in the 2nd trimester is at least as good as in the 3rd trimester. But the same group that studied the vaccine effectiveness in the United States concluded differently. They showed that the vaccine effectiveness of vaccination in the 2nd trimester is lower than the vaccine effectiveness of a 3rd trimester vaccination. So more studies are needed to gain more insight in this timing of this vaccination. And but Public Health England, on advice of the GCVI, widened the interval for the vaccination in England. So their women can receive the pertussis vaccination from the second trimester onwards, but they are hoping that most of the women will take the shot after the 20 weeks scan, which in the Netherlands is the echo at 20 weken. More. So, I don't know how you call it in English. A scan is an echo. No, doesn't matter. And with respect to timing, the colleagues of the EIV department are performing the MICI study, and these colleagues are also in the room, so you can ask them for more information. The MICI study is a study on maternal pertussis immunization. In the first group, the mothers are vaccinated during pregnancy, and in the second group, the mothers are vaccinated directly after pregnancy. And what's very nice about this study is that the infants receive not the routine national immunization program of the Netherlands, but a reduced schedule. And they start also 1 month later. So their first vaccination is at 3 months, and the second at 5 months, and a booster dose at 11 months. And they hope to gain insight in if this reduced schedule is a possible way to go further for the national immunization program in case the mother receives a maternal pertussis immunization. And Nienke and Daantje can tell you more about it if you want to know. So in summary, we can say that preterms are at increased risk for vaccine-preventable diseases, and that our data showed that they are at increased need for artificial respiration, and they are staying at the NICU much longer than term infants. We do know that protection is needed as early as possible, but in fact we see a delayed first dose, and we don't know if this current schedule is good for preterm infants. We further know that maternal pertussis immunization is safe and very effective, but we do not know the exact optimal timing, but we do know that there is, at least to date, no negative effect of deblunting. So what we need is studies on the vaccine effectiveness with a different timing of maternal vaccination, and then stratified for preterm and term infants, so we can learn and try to protect all infants, so not only term infants, but also preterm infants. And that's the acknowledgement page with many people are involved in the studies and all the other issues. So thank you all very much. And this was my talk.